Well, good morning. I'll go ahead and get started. I'm pleased to report that Iowa's recovery from COVID-19 continues to move in a positive direction on all fronts. 87 of Iowa's 99 counties have 14-day positivity rates below 10%. Our long-term care facilities outbreaks are down to 29, and COVID hospitalizations are down 85% from the high point in mid-November. As a result of declining hospitalizations, Mercy One Des Moines is able to now close their dedicated COVID ICU unit, another encouraging sign. And while virus activity continues to trend downward and remain stable, our administration of vaccine continues to improve. Yesterday, the CDC's vaccine tracker reported that Iowa ranks 22nd in the nation for percent of vaccines administered. Of the 615,100 doses of vaccine distributed to our state, we've administered 485,710. That's a rate of about 70%. And according to our state numbers, which update slightly faster than the CDC site, we're close to having administered 500,000 vaccines to Iowans at an administration rate of about 80%. I'm proud of the progress that we're making, and I want to thank the Iowa Department of Public Health team, our local public health departments, and the many vaccine partners across the state for making this possible. And of course, I want to thank a thank you to the Iowans who are choosing to get vaccinated and to those waiting patiently for their turn. There's more good news to share today that should reassure all of us that our supply is increasing, and soon we'll be able to vaccinate even more Iowans every week. Last week, a decision was made to hold the weekly vaccine allocation for 5 counties that hadn't administered at least 80% for their weekly supply. I want to be very clear that that was not meant to be punitive. Instead, it was intended to allow local public health officials a week to administer the remaining supply of vaccine before their next shipment arrived. Each of these counties had several hundred unused doses still on hand, and their administration rates ranged from 25% to 53% the previous week. With demand for vaccine far exceeding supply, there's no reason that available doses should go unused week over week. Vaccine should be going into the arms of Iowans, not sitting in storage. Our goal is to vaccinate as many eligible Iowans as possible each week based on the available supply, and we're working together to make that happen. Members of my team and the Iowa Department of Public Health were in regular contact with the 5 counties last week, determining why their vaccine had not been used and really working to develop plans to get it administered within the week. I want to stress that this change will not disrupt vaccinations this week for residents in those counties. They will still be administering vaccines. Since Monday, we've been monitoring administration activity across the state and have reached out to a handful of counties. Each has plans in place for this week that will ensure that they meet the threshold that we put in place. So I'm pleased to report that all 99 counties will receive their allocation as normal next week. And even more good news, the number of doses they'll be receiving will be increasing. So we're continuing, small amounts, but we're continuing to see those numbers go up. Yesterday, on the weekly COVID-19 response call with the White House, we learned that an additional 2.5 million doses of vaccine will be available on top of the 11 million that's currently being allocated nationally. So that's a new total of 13.5 million doses that will now be distributed weekly among all states. In Iowa, that means our allocation of 49,900 this week will be almost 62,000 doses next week, which is an increase of 24%. Additionally, the weekly allocation for the National Pharmacy Program will double. They were receiving 1 million, and that will go to 2 million doses. And this increase will help Iowa's participating Hy-Vee and the CPESN pharmacies even further expand vaccine access to communities across the state, and especially including rural Iowa. So it's a great program, and it's exciting that they're increasing their doses. The White House also announced that it expects the FDA to announce its decision regarding emergency authorization for Johnson & Johnson's 1-dose vaccine by the end of this month. In preparation, they're coordinating very closely with General Perna and his team so that distribution of the vaccine can begin immediately if it's approved. While supply will be limited to just a few million doses at the initial rollout, Johnson & Johnson's goal is to distribute 100 million doses by the end of June. The White House also committed to providing states with allocation projections beyond the current 3-week time period that they've talked about the last couple of weeks. And not only will this make a positive difference at the state level, it will also enable our local public health departments to plan longer term with their vaccine partners to coordinate clinics in communities that they serve. So that's good news, too, to provide that certainty that we're all looking for. Finally, the White House informed us that they are tracking a significant decrease in vaccinations over the weekends, and they ask states to focus on increasing weekend vaccination capacity and hours when it's more convenient for many people to get vaccinated, and I fully support this approach. Increasing vaccination clinics on the weekends will help us meet our goal of quickly vaccinating as many Iowans as possible, and I know that's something that we all want. Last week, like all other states, I talked about our looking for a vendor to set up registration and scheduling process. We've been exploring every tool available to improve the vaccine distribution process. In order to understand the full extent of our options, we issued an RFP, and we have been in discussions with Microsoft about their vaccine registration and scheduling platform. After learning more about the breadth of Microsoft's solution and reviewing the challenges faced by some other states in their rollouts and speaking with our various vaccine partners, we have made the determination not to move forward with the contract. It quickly became apparent that integrating the many already existing registration and scheduling platforms that are used by some of our public health departments, pharmacies, as well as other vaccine providers, it would not be possible in a timely manner without significant disruption to their current systems, and we did not want to slow down the progress that we're making. So we're now shifting our focus from building a different system to optimizing the overall registration and scheduling process for Iowans. And this will be done in close partnership with, again, our local public health and our vaccine providers. We know that barriers still remain for Iowans who are currently eligible, and we're actively determining how we can leverage existing partnerships to provide an easier alternative to online scheduling. So further updates will be provided as we continue to work on this effort, and we'll keep you all apprised to that. While vaccination is top of mind for all of us, we can't forget the important role that COVID-19 testing continues to play in our recovery, particularly in our ability to monitor virus activity statewide. Last October, we updated the state's data dashboard to report testing data by the total tests conducted in the state, in addition to reporting tests by individuals. At that time, I explained that continuing to report results for individuals would become more complicated and less valuable over time as repeat testing became the norm. I also mentioned that Dr. Brodati and her team of epidemiologists were considering that a change in test reporting might be necessary to better align with how other illnesses are monitored long-term, and they were preparing to bring their recommendations to me. Then the November surge happened, and our priorities shifted to managing the situation and really recovering from it. So now that we have the time, the time is right to implement a change in how we report test results. Today, I've asked Director Garcia to provide more information about the plan to update testing data this week. Kelly?
Thank you, Governor. I'm happy to provide an update on our reporting for testing. I also had the chance to talk with reporters earlier this morning and dive a little bit deeper into that process. During the early months of the pandemic, we reported the number of new positive COVID-19 patients and positivity rate daily. But over time, as our rate of testing increased, monitoring overall trends, in addition to recent activity, has become increasingly more important. Looking at key data points in terms of a 14-day rolling average, aligning with the incubation period of illness, allowed us to better monitor incidents or new cases of the virus, giving us a more complete picture of current COVID-19 activity across the state, in specific counties and even down to a zip code level. Then, as antigen testing became more readily available and commonly used for routine testing, the number of tests by individual began increasing significantly. I would say it really exploded. And the process to deduplicate these tests by individual has become even more complex. As the governor mentioned, in early October, we made the decision to begin publicly reporting results for both tests by individuals and total tests, so Iowans could compare both reporting methods, knowing that at some point it may become necessary to make a change that better reflects recent activity and to make comparisons across state lines, which will approach this a little bit easier, I think, for those comparisons. And now we're on the cusp of at-home COVID-19 test kits becoming available in an over-the-counter method and at a price point that's much more affordable than other testing options currently available. In fact, at least 3 products are expected to come online this spring, ranging from $25 to $50 and promising test results in just minutes and in the comfort of your home. While this is certainly good news for many reasons, the expansion of testing approaches will further limit our ability in the Department of Public Health to monitor all test results at an individual level. As we mentioned in October, Dr. Padati and our team of epidemiologists, overseen by Dr. Garvey, were considering whether this change would be necessary, and they were prepared to bring that recommendation forward to the governor. We were finalizing these plans and expecting to change them now, and that's really because in the thick of the fall and into the early part of the year, we were responding to a surge. So the timing wasn't right, but it is now. We're expecting to change this methodology on the coronavirus.iowa.gov website by the end of the week. And the shift from individual tests to total tests means that the positivity rate overall will align with total test results. Lastly, while I'm here, I wanted to take the time to, again, thank our partners at the county and local public health level. From the beginning of this pandemic response, it's been an effort unlike anything we've seen before. It's been a sustained response, which has been incredibly challenging. It looks a little different for everyone, but for our counties and for our local public health officials, they have been critical in navigating this response. They've been on the ground since the beginning. And now they are critical in our vaccine administration and ensuring that Iowans throughout the state have access to the vaccine. I cannot thank the counties and our local public health authorities enough. As you know, the supply has been a major constraint. Allocation numbers have shifted, guidance has shifted, and throughout this effort, our local public partners have made this work. I know at times it's been frustrating, but we are moving in the right direction and heading closer and closer to that light at the end of the tunnel. When I talk about our programs and services at the Department of Public Health and the Department of Human Services, I often say that this is a team sport. We cannot do our work alone, and that is certainly true in our pandemic response. This collaboration with locals, our healthcare providers, our pharmacies, our AAAs, other state agencies, legislators, and many other stakeholders has been a real bright spot in this time. So while we had to shift and adjust almost daily, sometimes multiple times daily, I just want to acknowledge the incredible work being done by everyone to get through this. It's been a long road, but we are very squarely on a path, and we need all of our partners to see this through. To the Iowans watching, please continue to follow all of the mitigation measures that we know. Wash your hands, stay at home when you are ill, socially distance, and please wear a mask. Thank you, Governor.
Thank you, Kelly. And I want to thank your team for the recommendation to ensure that our data is what we need to continue to monitor virus activity now, and that it better aligns with our long-term reporting progress. So just thank you for all of your team's effort and everything that they've done. This week, much of the nation is in the grips of Mother Nature. Severe winter weather is again taking its toll, but this time it's causing an energy emergency in Texas and other south central areas of the United States, where some of Iowa's energy supply comes from. On Friday of last week, I signed a proclamation easing transport rules for propane in Iowa. Then on Monday, I signed another proclamation to temporarily suspend regulatory provisions pertaining to hours of service for crews and drivers hauling diesel, natural gas, and other fuels used for residential, agricultural, and commercial heating. These steps help ensure critical fuel deliveries continue in our state to keep Iowa running despite challenging conditions. Additionally, the Iowa Utility Board has been closely monitoring the regional situation as it's been developing since last week and coordinating with Iowa's energy companies, cooperatives, and municipalities to ensure service remains stable across the state. Here to provide an update is Jerry Huser, Chair of the Iowa Utility Board. Jerry?
Thank you, Governor, and thank you for your leadership on easing regulatory provisions for propane transportation, diesel fuel, and other heating fuels that are critical for Iowa homes and businesses. Today is the 7th consecutive day that temperatures have dropped below zero, but some areas of Iowa have experienced a daily average temperature below zero for 12 straight days, according to the National Weather Service. Other areas of the nation, especially the south and central states, are also experiencing very rare and severe cold weather that has caused high demand for electricity and natural gas and has strained the regional electric grid. Since last week, the Iowa Utilities Board has continued to work with Mid-American Energy, Alliant Energy, Black Hills Energy, along with all of our rural electric cooperatives, municipal utilities, and their respective utility associations to closely monitor the electric and natural gas supply to ensure that Iowa customers continue to have those services. Certain utilities in Iowa, including our municipal utilities and rural electric cooperatives, received their power through agreements with the Southwest Power Pool, also known as SPP. It is a regional transmission organization responsible for coordinating and controlling the day-to-day electric transmission markets for states from Minnesota to Texas, including Iowa. The SPP encountered demand that exceeded its capacity to provide to its members. As a result, SPP declared a series of energy emergency alerts over the past 2 days. Currently, we are in an Energy Emergency Alert 2. SPP has escalated these alerts to the highest level and instructed some of its members to immediately reduce electricity demand by a megawatt needed to prevent further and uncontrolled power interruptions. Due to that demand outpacing available supply in certain areas, some utilities were instructed by their regional transmission operator to curtail their electric load. However, Iowa's largest utilities, Mid-American Energy, Alliant Energy, and Black Hills Energy, have not been affected by any curtailments and have projected sufficient supplies to meet the needs of their electric and natural gas customers. Part of the reason for this is that there are 2 RTOs, or regional transmission organizations, that serve Iowa. SPP, the Southwest Power Pool, is the one that serves the southern states of Oklahoma and Texas, and we are attempting to assist them in this crisis. While other sister states are still struggling to restore power, the Iowa Utilities Board wants to thank Iowa's numerous utilities, especially our rural electric cooperatives and our municipal utilities that are using peaker generation to provide service across the state. They have asked their employees to work 24/7 while doing everything possible to keep lights on and homes warm and safe. We are asking Iowans to continue to support those workers and also look to conserve energy in your homes and businesses. I want to thank the governor for giving me the opportunity to present and for all of her leadership.
Thank you, Jerry, and I appreciate everything that you and your team are doing in collaboration with all of the suppliers and utility companies that serve the state. As Jerry said, there are some simple ways that we can all help conserve energy to keep lights and heat on for our neighbors. I want Iowans to know that that their state government is doing its part to lead by example. Beginning Friday last week, we switched from natural gas to fuel oil to power boilers that heat state buildings and reduced the temperature settings in all of our buildings as well. So I too want to encourage other large Iowa employers to consider the ways that they can help conserve energy throughout the remainder of this week. So in closing today, I am pleased to have a very special guest with us. Alan Hoover III, great-grandson of the 31st President of the United States, Herbert Hoover, a native son of West Branch, Iowa. West Branch is home to the Hoover Presidential Library and Museum, which is preparing for a major renovation, something that hasn't been done since 1992. To help make that possible, I've proposed a $5 million appropriation to fund the Hoover tax credit and encourage donations. 25% of the amount gifted to the Hoover Presidential Library and Museum renovation project through the Hoover Presidential Foundation would be eligible for credit on Iowa state income taxes. The National Archives requires 90% of the money needed for the project to be raised before construction can start. So this is a way that Iowans can make this project possible, and there's no one better suited than a member of the Hoover family to share why this project is so important. Alan?
Thank you, Governor Reynolds, for this opportunity to be here with you today. As many of you know, great-granddad was born in West Branch, Iowa, and later elected as the only president of the United States to come from this state. And throughout great-granddad's life, he had a special connection with Iowa. When he was a young boy, he was in his father's blacksmith shop in West Branch. And as young boys can be prone to do, they have a mind of their own, especially when they're around hot iron. And in this case, great-granddad stepped on a hot piece of coal that I imagine not only hurt, but it left a mark on his foot that would be there the rest of his life. He affectionately called this mark his brand of Iowa, that was with him every step of the way as he went through life at the Paris Peace Conference, Secretary of Commerce in the White House, and the years beyond. Great-granddad felt a genuine bond with Iowa, so much so that he chose West Branch to be his final resting place, along with his wife, Lou Henry. And not far from their graves is the Presidential Library Museum that bears his name, which, as the governor mentioned, has been almost 30 years since the last major renovation. And by the way, that is the longest time period of any presidential library in the United States to go without having a major renovation. And the Hoover tax credit is such an important component of this project. I was humbled yesterday in going through both houses of legislature and visiting with legislators and senators and discussing this project and seeing how much support there is for this Hoover tax credit and for Herbert Hoover's memory and his connection with Iowa. And on behalf of the family, I'm deeply grateful. We are deeply grateful for the people of Iowa, both houses of the legislature, and Governor Reynolds for this tremendous support in helping this project become one step closer to reality. Thank you. Thank you very much.
Thank you, Ellen. This truly is a way that Iowans can support the renovation and preserve an important historic landmark in our state for generations to come. The goal is to complete the project by August 10th, 2024, in honor of President Hoover's 150th birthday. So we look forward to helping your family achieve that goal. Again, thank you for coming and being a part of the subcommittee meeting, and hopefully we look forward to signing that bill sometime soon. Thank you. And with that, we'll go ahead and open it up for questions.
Governor, do you believe that Iowa's 29-day early voting period is too long?
I can't remember. I think we condensed that some. I thought what it was previously was too long, and I think this was a compromise that they landed on. So it is a long period of time. I think it's something we should continue to look at. I'd be willing to take a look at that.
Governor, you just talked about the supply getting increased for next week.
Yep.
Polk County said they've received information that their Moderna doses are going down by about 2/3 for next week and then increase slightly the week after that. Is this just for Polk County being reduced this much, or are there other counties being reduced as well?
I think that a lot of that is weather related. Is that some of it is weather? Kelly, why don't you just go ahead and answer that? I know part of the story.
Yeah. As you can imagine, and particularly because of the update Jerry just gave, there are some supply chain issues at the moment because of where the distribution centers for both vaccine manufacturers are located in the southern part of the U.S. We expect that to be made up within the week as the temperatures warm. We do shift Moderna supply at times because Moderna is easier to handle. In Polk County, we are very lucky to have Polk County as a partner that can take a pretty tremendous amount of Pfizer supply. They're uniquely situated to do that. So there is a component there that is playing into that factor, and we're happy to talk with you kind of in more detail about what that looks like. We do make these shifts on occasion because of what is available. And then Moderna, the federal government is doing a similar kind of redistribution of Moderna versus Pfizer in this next week as well. So all of that played into the allocation.
Will Pfizer offset? Will you increase that to offset it, or will they just go with a lower supply?
No, everyone's remaining steady. There's just sometimes people get more Pfizer and sometimes people get more Moderna, and that shifts week to week.
And Dave, that's one of the things that we've talked about on the White House call with the administration is how important it is to have some certainty in the doses. And they've made it clear while allocations can shift somewhat, and weather has played a little bit of a role in that, that we can be assured that, for 3 weeks, this is at least the minimum allocation that we would get. On the call that happened yesterday, I can't remember if I said that in my remarks or not, the governor's actually asked if we could extend that even beyond 3 weeks to maybe talk about 5 to 6 weeks. Again, that helps everybody plan, schedule, and I think just have a better ability to get the vaccine out and administered. So they are willing to take a look at that and seemed very receptive to that, according to what we heard on the call. They heard on the call.
Are you dumping the idea of a statewide call center as well as an app or?
No, we're not. So as we've, again, kind of researched what other states are doing, we're taking a look at 211, the call center that we have, and we're looking for opportunities, Kay, that we can enhance that. Part of the issue is our Iowans are already used to utilizing that call center, and so that's normally where they would go, and we just want to be careful about layering other options on top of that, but we want to make sure that we have it staffed appropriately, that we are helping individuals that can't utilize the technology and go online and look for an appointment. And so we're working with the Department of Public Health and other agencies in our office to really enhance our 211 call center to meet the needs of Iowans.
Can the 211 call centers make appointments for people?
Well, not yet, but we're looking at what we can do to enhance that, right? Yeah.
So what would your advice be to people right now who are struggling to get appointments?
It's a place to call for them to walk through how we do that.
But if a lot of people are, especially seniors, are really struggling, especially if they're not good at
so
going
that's
online.
why, we're talking about a lot of different options. That's why we're trying to utilize the AAAs. We're looking at the 211. We have local public health. Kelly talked a lot about the role that they play in helping their communities know how to receive a vaccine and what that looks like. And so we're continuing to monitor all of that. But when we really dug into what the options were and what was available and the timeline to get that done, it just didn't make sense for us to move forward, especially with the registration and scheduling component, because of all of the different providers that are tied into that right now and the systems that they had. So we're continuing to look for ways that we can streamline the process and make sure that we're meeting the need of Iowans. And we're still so limited in the vaccine, so that still remains a big.
Like
I'm sorry, what?
If I'm a senior, what would your
211,
advice be
right?
to someone who is really struggling? What should they do today to try to find an appointment?
Call it AAA.
Yeah. Okay, call a AAA would be the first place for them to start. And then we'll continue to enhance that and build out areas where we can help them.
Governor, on June 18th of last year, you said Iowa was well into the recovery phase of the pandemic. And at that time, I think we had something like 678 deaths, and we're over 5,200 now. And the infection rate is twice what it was. Given all of that, do you think it was a mistake to say in June that we were in the recovery phase?
Well, I think our numbers looked better at that time. This has been an unprecedented pandemic, and Iowa is not unique. We saw a very similar situation happen across the country in November and December. I think we were able to take advantage of a downturn in numbers. We saw the hospitalizations go down. We saw our positivity rate go down. We were able to open things up, and we played ball this summer, I think, which helped with the overall just attitude to deal with COVID-19. And like when as we approached the winter months and people started going inside, we saw our numbers escalate. We saw a brief surge like many of the other states did, and we acted appropriately. So again, we learn every day. We gather new information and we make decisions accordingly.
Can you characterize where you think we are now in the pandemic? I mean, with going back to school, relaxing the mask mandates and the other mandates, and all that makes it look like we're almost ready to say, okay, we're done, moving on with life.
No, I've never said that. You're mischaracterizing what I've said. I've never said that. Even in the healthcare declaration, I said I strongly recommend that Iowans continue to do the right thing. We've been telling them for over a year what they should be doing to address COVID-19. I don't think, that has changed. They know what they need to do. Businesses know what they need to do. We've actually started our 99 county tour, and as I've met with businesses, they're doing exactly what they've been doing because they want to make sure that their customers feel safe when they're visiting their facilities. But the fact of the matter is, we are in a better place. So if you want to mark down today, we are in a better place. Our hospitalizations are down 85%. Our long-term care outbreaks are down 80%. Our positivity rate, when you look at the 7-day average, is under 5%. We have 65 counties that are 5% or below. So if we've vaccinated almost 500,000 Iowans, and so we've actually provided vaccine to more Iowans than we have positive cases. So let's just continue to do the right thing, to be vigilant in what we've been doing. And as we continue to increase our numbers, the allocation of vaccines that we get, and we continue to get more people vaccinated, there is light at the end of the tunnel, and we're going to move through it. It'll be, I think the end of February, we should have most of our long-term care facilities and assisted living facilities will have both first and second dose, boost dose. So that's really, really good news. And we're continuing to provide vaccination to teachers who want it, and our essential workforce, our first responders and Iowans that are 65 and older. So we're going to continue to get that administered, and we're going to continue to encourage Iowans to be responsible like they have been, and hopefully we'll continue to see the numbers go down. And you're seeing that across the country, actually. If you look at the map, it looks much different. It was a solid red in November. States that have been in serious lockdown since March, there was no different. They were also experiencing that uptick during the November, December, and then some of your southern states were a little bit later in moving through that. Kay, did you have another
Governor
question?
Ducey in Arizona has decided that schools shouldn't issue letter grades to students. It should just be pass-fail because of the disruptions in education this year. Is that something you're considering in Iowa, to direct schools to not issue letter grades because of the disruption in education?
Yeah, I'm proud that most of our, by far the vast majority of our schools have been open, and they figured out a way to get the students safely and responsibly back in the classrooms. And it is heartbreaking when you look at the data and you see the statistics of the impact that this is having on our children, and especially those who need their schools and need to be in the classroom the most. And so I'm hoping because of that, we're going to be in a better place. I said that I think that we need to do the assessments. I don't think that all states are doing that. I think it's extremely important that we do that so we have some sense of where we're at and what we need to do to get those kids that have fallen behind back on track. But I can't imagine the number of kids that have not been in a classroom for over a year. And I don't know, in some of these states, it doesn't look like it's going to be anytime soon that they're going to get back in. Data and science does not support them not being in the classroom. That's where they should be. We can do it safely and responsibly, and we need to focus on the kids and make sure that we're providing the services that they need and make sure that we're preparing them for their future. Thank you.